We are back. Welcome to episode 35 of the MedEdit podcast, your ultimate resource for evidence-based medical education.
This is the podcast where listeners decide what topics we cover.
We bring medical specialists who are leaders in their field to answer your questions.
I feel like we've covered weight as a health topic so many times already, but there's just such an immense amount of information out there, which unfortunately then usually means there's an immense amount of misinformation out there.
Because we had a ton of questions pour in after our last episode with Dr. Bass, we asked her to come back to the podcast to discuss some of the topics and questions we did not even get time to talk about last time. In case you missed her previous episode, Dr. Bass is board certified in obesity medicine. Also, go take a listen to that one now. It's definitely worth the time.
And I feel like everything we talk about today will help give you information to reach your personal health goals or your patient's goals.
Stick around for the second segment where we play another round of fact or miss for misinformation with our awesome guest.
We are your hosts, Dr. Cari Sorrell
and Dr. Jessica Gray. Toss endless online searching to the curb. Let us edit out the noise and bring you medicine without misinformation. Welcome to the MedEdit podcast.
I think that Dr. Bass's episode about weight loss and GLP-1s was probably one of the more popular episodes we've ever had since it's such a hot topic. It was filled with so much great information, but even with all the things we discussed, we wanted to talk about it some more. And we had a lot of people that had questions. Some of the topics we didn't get to include were talking about body composition and exactly how we look at that, why it matters, and maybe a better indicator of overall health than just looking at weight.
Related to that and important, what are the physical activity recommendations for adults for overall health? Lastly, muscle loss related to GLP-1s was a question that came up a lot after our last episode.
So much to talk about today, and we're very lucky to have Dr. Bass with us. Welcome back, Dr. Bass.
Thanks for having me.
Let's jump in. What is body composition? Why is it a better measure of health than just weight? And what are some of the effective methods to evaluate if your body composition is ideal?
Okay, so body composition refers to, I always call it looking under the hood. And so, we talked a lot last time about BMI and, obesity, one way to define it being defined as, over BMI over 30, but yet body composition, that's really a better way to look at it for health. So body composition is going to be a way to scan inside the body. There's a variety of ways to do that. And you're going to be looking at the sort of different components or compartments of the body as far as fat mass, the total fat percentage, your lean body mass, primarily skeletal muscle, bone mass, and water content. And so with fat, you can have all the fat you want under your skin that is not damaging to your health, but yet visceral fat centered around our organs, has a huge impact on health. And so, really, even how someone looks can be incredibly deceiving, right? And so this is a really great way to look at it for everyone. So you could have a person who looks thin who has high visceral fat. You could have a person that has a high BMI who has almost none. And really for health, it's those numbers that are going to be much more reflective of your outlook.
Perfect. And why do you think we should be looking at this over just weighing somebody in our office? You mentioned some health indication things, but what exactly are we looking at?
Okay. And so actually you get sort of, I guess, different kind of patients that this would be great for. For number one, for all of us, how much visceral fat, and that is going to be related to your cardiovascular risk, your risk for developing diabetes, and actually some cancers as well. Okay. I have a lot of CrossFitters. Okay. And actually, for them, sometimes they'll get really obsessed and, oh my gosh, the BMI is high. And I'm like, it does not matter. Your visceral fat is under 1 liter. It's nothing. Like your BMI is high because you have a high muscle content. For weight management, honestly, I can think of a patient in the last couple of weeks where I changed my calorie recommendations for her. She's an ex-college athlete, by like 500 calories a day because her muscle mass was so high, like off the charts. And so it really helps kind of tailor that response. And then also critical for all of us aging is this risk of what we call sarcopenia. Muscle wasting as we age is one of the primary predictors of poor health outcomes. And this is the best way to look at that.
Interesting. So What are some methods to measure body composition? Because obviously that's not something that we just rely on a home scale to do and a bunch of little calculations on our own calculator. How do we actually make these measurements more appropriately?
Right. And I will just comment quickly, the home scales, oh, they can be off by quite a bit. So as far as a medical grade body composition scan, you're going to be looking at either DEXA. So a lot of women will have this for a bone density scan. And so you can actually, there's a software package that if you scan the whole body, you can actually look at body composition from a dual, the DEXA scan. You have to be careful on that one because depending on how you norm the data, it can be really off in terms of body fat estimation. You can use the old school way, which was the skin calipers. I don't know if people are old enough, they used to do this on the president's physical fitness test. You can actually do water displacement, which is like an underwear that's almost never done, and a bod pod. Those are kind of hard to find. And of course, what I have in my clinic, which you can get a bioimpedance analysis. So this is the medical grade version of, kind of what you can get on some scales. And so AMA actually said back in 2022 that BMI was, insufficient. We should be really beginning to look at this for health.
That's very interesting. Now, so you're saying though that these scales are not something that someone necessarily would be having in their home and purchase for home. So they have to rely on more of this medical grade. And we don't have that in my clinic by any means, and they're expensive, and you have to have the right utility to use them and understand how to use them, obviously. So someone like you who is an obesity, board certified physician and does this all the time knows how to interpret those numbers. Somebody like me, I maybe sit there and like, oh, that's really cool, but I can't explain like the lean mass, the skeletal mass, and all those calculations compared to each other the way that you can. I've even done one of these personally at my gym. They have kind of like one of those. I've heard you and I have talked that they may not be as accurate as like what you have, but I get this number back and I'm like, okay, great. Like, what do these numbers mean? And so you're the missing component, right?
Yeah. And actually what I love about ours is it has this super simple little square graph. And it's like got, your fat percentage and your, kind of muscle and kind of what box do we want to be in, right? And so it can be, incredibly helpful. It's not that the home ones are horrible. You could maybe look at it as a qualitative measure, but the biggest concern is, again, that visceral fat number. So a lot of them you'll find give you a visceral fat score. We don't want that. I want a number. How many liters? Like, what is it? And, that's really, the most important thing for health.
And it uses like electrical signals. Is that kind of how it works?
Yep. Just a little bit. Ours is so cool. And I just want to say, like, you don't have to be like our patient or anything. People can just come by and like just get a scan. And we'll talk about it with them. But it actually, you stand in it and it bounces an ultrasound off the top of your head to get your height, which is sometimes disappointingly low. And then, you get a conduction of electricity through your all extremities. And then it kind of does that in a certain sequence, and that's how we arrive at that data. And this particular device that we have is actually the only one that's actually, there's published studies, it's normed against whole body MRI, four compartment, and DEXA as well.
I don't know. I may not want to know. We'll see.
No, it's great. What's fascinating is how fast your body can remodel. I mean, I know I had shared with you guys actually.
I would agree with that.
I had come back from surgery. I knew it was going to be bad, so I got one on purpose and then started going to the gym after four lift sessions, kind of going crazy because I gained 2.5 pounds on the scale, but yet body comp scan, oh no, I lost 1/3 of a pound of fat and gained 2.8 of muscle. So sometimes gaining is okay. That was a stride for health, even though on the scale I gained. Not the whole story.
That's really, really interesting. Yeah.
Okay. Well, say we came to your office and we got our scan. What are the ranges we're looking for? Like Jess mentioned, sometimes you get these numbers and you have no idea. What is normal?
So they're different for men or women, actually. And so, so I'm just going to go kind of, you could get a peak athlete, that might have a body fat number as a male, like kind of in the teens. Men, you generally want to have a total body fat percentage under 25%. And over 25 for men is often by most metrics what is defined as obesity. There's a few kind of different studies that will argue a little bit kind of in the fine print. But for women, you're generally going to say that, kind of athletes are actually going to be, 14 up to 20. Highly fit is going to be kind of like, the low 20s, but you're still considered totally normal, right? Just average, anywhere in that 25 to 31 as a female. And then a little bit of fudging into that. Some publications are a little bit different, usually somewhere between 32 to 35 percent of body fat and above is going to define obesity for women in a way that, clinically matters for health.
What are some factors affecting body composition that you're talking about, and how can someone maybe improve theirs?
Okay, number one, diet, nutrition, kind of like you are what you eat. Absolutely exercise activity, and also what kind of exercise. Strength training is going to favor muscle development, your genetics, ethnicity, also how old you are, and sex. So hormones, pre and post menopause, male versus female, those can affect that a lot as well.
And so what are the methods to maybe like improving it? So, you kind of know what your risk factors might be or where you're lagging. Maybe if you know your diet might be something you have to do, but what else can we do to just improve that body composition?
So it depends on your goals, right? And so when we say improve body composition, for the overwhelming majority of patients, this is going to generally be about reducing fat mass and gaining muscle mass. Now, a lot of times that why we check at the start of what we call a weight loss journey is that it can be very hard to try and build muscle at the same time you're losing fat. And so, if I see a patient that's got really great, skeletal muscle mass, I'm like, oh, great, home free, on the muscle side, right, to gain muscle mass, you need adequate protein intake, and you're going to need to stress that muscle. You're going to need to engage in resistance training, preferably with some kind of heavy lifting, is how you're going to grow it faster. Maintaining, you can lift low weights at high reps, that's perfectly fine. But if you're actually trying to increase that, we would want probably a little bit more weight on that. And as far as decreasing fat mass, that's kind of generally our advice as far as like kind of losing weight. We would want to look at, while preserving adequate protein intake to not lose muscle mass, we're going to want to make sure that our calories are in balance in both consideration of your current body composition, but then also like your activity level.
Yeah, and you mentioned activity level, and that is super important. And I think for all of us, all three of us, it's super important because we're all very active, constantly looking for ways to challenge our bodies for our health as well as mental health. But maybe our listeners are not. So can we review kind of what the actual recommendations for physical activity for adults is currently?
Okay. And so I want to be clear, like there are kind of two sets of recommendations, and this depends whether you're looking for maintenance, just general care and keeping of a human body. And that is the one that we most often hear, but we usually hear it partially. So almost everyone, I think, can spit out, 30 minutes a day, 5 days a week, right? And so the caveats on that are, that is moderate activity. So we're not talking about walking, right? We're talking about something where you're working hard enough, you can probably get out a 3 to 5 word phrase.
As everyone says.
No, that's what we call NEAT, non-exercise activity thermogenesis. And so, but exercise, you got to be working hard enough to be qualified as moderate. I can get out a few word phrase. We're not having a fun conversation. The other little star on this is, oh, by the way, if you're going to get into vigorous activity, I am working so hard, I'm panting, I can't talk at all. You can take that down to 75 minutes per maintenance, but we usually forget to finish the rest of the sentence, which is, and these are CDC recommendations, and 2 to 3 days of strength training, which is so important. That is the recommendation from the CDC. That is how we get our 2,000 calorie a day diet. Actually presumes that you would be engaging in this, what they say is the bare minimum. And a lot of us, maybe if we're just starting out, are not doing this. But that is for maintenance. And the recommendations are much different for loss. And in fact, they are double. Now, I will add on the maintenance side, your choice is 150 minutes a week of moderate or 75 of vigorous, right? So if we're working so hard, we're panting, cannot talk at all, that can be less, okay? On the loss side, publications kind of have a range of 270 to 300 minutes per week of moderate activity. And again, you can have those numbers for vigorous. Now, at plus are 2 to 3 days of strength. And there's some other recommendations in there that can be, really of value in terms of flexibility, balance. But this can be really daunting for someone who's just starting out. And I just want to be clear. You can all have the thought that I did when I started, which is, well, haven't worked out for decades, right? So 5 minutes is literally an infinite improvement for me. And
Mhm.
that's the thing is like, yes, this is a goal. Nobody gets there like overnight. And so it's good to know what the true recommendation is, the full kind of text of that sentence, and that there's a lot to do this, but our bodies are amazing and they really respond quickly, both for good and for bad. So when we're sedentary, man, we can
Mhm.
lose muscle mass fast, but it sure doesn't take long at all to build that back. And so it's really amazing. That's something you can see on body composition scans is just how quickly we can change inside if we ask our bodies to through training.
I love that. I love that so
It's
much.
really interesting because I know that there's a lot of, fitness people that I follow on all of our various social media platforms, just for ideas, trying to keep things interesting, do something different, you don't
Mm-hmm.
get bored doing the same thing over and over again. And one of the things they always talk about is, you're talking about vigorous activity is, we still have certain muscles in the body that you can kind of do that to daily and they
Mhm.
recover so quickly. There's a reason you can do core exercises on a daily basis and
Mm-hmm.
not get the same fatigue as when you have leg day,
Mhm.
and
Oh yeah.
that's, they're designed that way.
So why is physical
And
activity so important to maintaining overall health?
right. One of the primary reasons is going to be that kind of what I talked about earlier as far as sarcopenia and longevity. I mean, it left unattended, honestly, starting in your late 30s, your body is going to be like, you can shed muscle mass like every year. Okay. That can be particularly quick, for women after menopause or with any what we call like the catastrophic theory of sarcopenia. If you've had any insult or injury, you've been in the hospital. What do people do in the hospital? They sit there, and you can actually get huge dips actually in the amount of muscle mass just in that. And so really trying to prevent that to give our bodies like the wherewithal and reserve to be able to recover and to still have preserved strength and mobility like later in life is super important.
Next question actually piggybacks off what we discussed in our last episode, but it's one that comes up pretty frequently when you talk about GLP-1s. And do GLP-1s destroy your muscle mass?
No, absolutely not. So, do you, if you do not take any intervention at all, if you just sit there and starve, you will lose weight according to something called Forbes rule. Okay. And that means for every pound you lose, 75% is fat, 25% is muscle. Okay. But are we going to just leave you alone? No, absolutely we're not. Okay. So there are actually a lot of longitudinal studies where even under severe calorie deprivation, if a patient has adequate protein intake, they actually don't have significant decreases in muscle mass. And honestly, for our patients, we want more than that, right? I want you to have adequate protein intake and we want to get some strength training in as well. So your story does not have to be that at all. And I can tell you from having the body composition scans, no, we have patients that absolutely are just dropping in fat mass and they're staying exactly where they were for skeletal muscle. It's going to depend on their intake and their activity.
Yeah, and I think the point you mentioned about intake is so important
Mhm.
because
Mm-hmm.
especially women seem to
Oh,
really
yes.
not realize this.
Yes. Yeah. I'll be honest, like, I don't like
It's one
this
of
one
those
either.
quality over quantity things.
Yes, and it's not even just that because actually how we intake protein also matters. So it turns out, right?
Mm.
The signal being sent requires, I don't know if you guys care about this, kind of 2.5 grams of leucine, and that's usually a little bit less than 10% of a total protein load. Therefore, recommendation is you need at least 30 grams at a time and at least 2 times a day. It does not, no evidence really that there was a lot of improvement with a third time, but as a bare minimum, if you're fairly young, like under 40, at least 30 grams at least twice a day. Super fun fact as we age, and I'm in this group, of course, we're not as great at absorbing protein. And so those numbers actually will change a little, and you might need like a little bit more.
Thank you so much, Dr. Bass. Everything you are saying is absolutely phenomenal. I think every time we sit down with you and are talking to you about this subject, we just get more and more information that we can actually utilize in both our lives, our patients' lives, our friends' lives. It's really great. We're going to go ahead and transition to the second part of our episode, fact versus myths. And Cari and I are going to play this one together. So, Cari, you are up.
Let's do it.
Yes, we picked out some 4 facts from social media, and
Yeah.
I'm going to quiz you this time and see
Okay.
if you know some of these.
Alrighty. And go ahead.
All right. So, is it best to eat 1 full meal per day to lose weight rather than like the 3 meals per day?
This seems to be somewhat of a controversial one based on what I was reading, but overall, I would say it's kind of a miss would be the answer. Skipping meals will lead to some temporary weight loss, but necessarily it's hard to maintain that over time, right? Because you need fuel to function at its best. And if you're going to be doing daily functions, it can kind of over time be difficult to do that if you're really limiting to 1 time a day. I think Dr. Bass mentioned just previously that even twice a day of a high protein load is really what's recommended. And so, I think it depends on what you're eating more than anything. So that's why it's kind of controversial, because some meals that are high in certain fats and things like that are going to be recommended differently than if you do have a high protein load. And a lot of times, if you do end up doing one big meal or skipping a lot of meals, then you get really hungry later, and your body's natural way of regulating that is going to kick in, and you're going to overindulge and end up eating more calories than you would have if you just had a snack or something.
That's what I tell my patients. I'm like, if you could just have the 3 meals, just a solid 3 meals or a minimum 2, but don't skip something so that you're inclined to want to go grab snacks. And, snacks are terrible. If we could get rid of them, that would be so helpful.
Yeah. I do think overall, though, and this is something that Dr. Bass has mentioned a few times to us, is that I do think, though, if your body is telling you, if you're not having those hunger signals, I don't think you necessarily have to stay on a schedule. And that's what I don't necessarily like about the 3 meals a day.
True.
Because everybody's hunger signals are a little bit different. So they may be only getting those signals twice a day to eat something that's high in protein. And I think that's perfectly fine if it's not the quote unquote 3 meals a day. I think when we get into trouble is when people are really focusing on just 1 meal a day, regardless of the hunger signals that they are getting. That's kind of the concern. Like their body is like, no, you are really, really hungry. You need to put something in. And it's like, no, I'm only eating 1 meal a day. Because again, that leads to that overindulgence. And then it also means you're not getting enough fuel in your body to function. Or if you have other health goals, you may not be hitting your weight gain or weight loss goals or muscle gain goals.
Right.
So I think that's why it's kind of a caveat, depending on what your body seems to be able to function off of, what your goals are currently, and then also the type of meals you're eating.
Right. Okay, here's one. By taking vitamins, you can get away with eating less healthy foods. Like you hate veggies, just take some vitamins, right?
Yeah, I would say it's overall a miss. We really like to try to emphasize getting a balanced diet as our main source of our vitamins, right? If you want a balanced plate, you want it to have nutrients. A multivitamin can sometimes make up for what's missing. Like if you're iron deficient, yes, you need to supplement iron probably over what you're going to be able to get in your diet. But eating fruits and vegetables have other benefits other than just the vitamins and minerals that you are getting. There's fiber, there's a lot of other things that it really helps with. There are some chefs even that will tell you, instead of peeling everything, like throw it in. There's a lot of nutrients in there. And there's a lot of people that advocate for that. Grinding up fruits and veggies and then dehydrating them and processing them, you're going to have some change in the nutritional benefits of what you're absorbing if you just ate the fruit and vegetable.
Absolutely. I think that's what I talk about a lot, because the patient's like, well, I don't like it. I made it into a smoothie. And I'm like, okay, a smoothie every once in a while with fresh, fruits and veggies is a good idea to get some of that nutrition. But if that is your main way you're consuming the fruits and veggies, you're missing out on so many of the health benefits. You're destroying them with the actual blender, all that good fiber that really is helpful and that helps with weight loss and not just nutrition.
Yeah, I think that's what people forget too, especially with the whole smoothie trend, is that, liquids are going to move out of your stomach very quickly. They're designed to do that. Within a few hours, your stomach is empty again. And so you're going to be hungry again.
Yep.
You add fiber, you add a little bit of healthy fat content, and that sticks around for longer, which means that you stay full longer, which means overall you may consume less calories because you're not hungry all the time if you're just relying on liquids or things that are, I would say, overly processed for your diet.
Right. Well, I see some of my patients come in with these long lists of vitamins and supplements. And when we actually talk about their real diet, they're missing so many of the components and they're relying on those supplements to fill those holes and those gaps, which is just wrong.
Absolutely. I mean, I think we all know as physicians, there are certain vitamins that we recommend because, we have evidence that people are naturally have a difficult time getting, like vitamin D, for example. We have guidelines for that supplemental recommendation because we have evidence that diet alone for a lot of people is not sufficient, or like you mentioned, iron in some people who just don't absorb it as efficiently or are losing iron for some reason. So those are very specific instances where you should talk to your doctor and do what they tell you to. But as far as for just overall trying to get all of your nutrients and vitamins in your supplements and not your food, really food should be our first way to do that.
Yeah. So thank you so much again, Dr. Bass, for joining us. Your expertise is exactly what our listeners are searching for. I can't wait to come try out your cool scale. Don't forget, if you're a listener claiming CME credit, please look in the show notes for instructions.
And for all of our listeners, thank you for tuning in. Please like, subscribe, follow us on socials, share this episode, and let us know what other topics you'd like to hear.
Thank you for listening to the MedEdit podcast. Please click the follow button to be notified when more episodes become available. For more information about this episode and to find out how you can reach Dr. Cari Sorrell and Dr. Jessica Gray, please visit today's show notes. Be sure to follow us on our socials, Facebook, Instagram, and TikTok to stay up to date on all things the MedEdit podcast. The information and content has been made available for informational and educational purposes only and does not constitute a physician-patient relationship. If you need medical advice or help, please contact your personal physician. The views and opinions of the guests do not necessarily reflect the views of Dr. Jessica Gray or Dr. Cari Sorrell. This podcast should not be considered an alternative to medical advice or diagnosis or confirmation of an illness or disease. Please seek help from your personal care practitioner. Thank you for listening, and tune in next time.